video, I would be talking about edema. And edema is a medical term for swelling. Edema usually happens in the level of the circulatory system. I have here an abstract drawing of a circulatory system where edema usually occurs. But before that, I would like to give emphasis on the two main components of blood, namely the plasma, which is the liquid component that would include water and proteins. Another one would be the cells. Cells that would include red blood cells, white blood cells, and platelets. Blood is an important factor to further explain how edema occurs in the circulation. Moving on, I have here an abstract illustration of the vascular bed. The vascular bed would include the artery, the capillary bed, and then the vein. In here, we have here cell tissues. Cell tissues are the cells wherein these blood vessels would transport oxygen, gases, and nutrients, and also water. We also have here the lymphatic system, which is a network of vessels. Lymphatic system is very essential in the circulation because it is the one that would get the fluid that is leaked into the interstitial spaces and return back into the circulation. I would explain that furthermore later on. So in here, you can be able to observe that the capillary bed has pores or fenestrations. These pores or fenestrations are very essential because it is where fluid, nutrients, and gases would be constantly moving in and out in order to support the said tissue cells. So in here, in between these tissues and then the blood vessel, we have here the interstitial spaces. Interstitial spaces. And to define edema, actually, edema would be the accumulation of fluid part of the blood into the interstitial spaces. So those fluid parts would be the water and then the proteins. So when or how does edema occur in the level of this tissue or this organ? So first of all is we have here the blood pressure, or the so-called hydrostatic pressure. Hydrostatic pressure is the pressure exerted by the blood that moves into this blood vessel. So we have here the hydrostatic pressure, or the blood pressure. This hydrostatic pressure or blood pressure also influences how much water would push out into the capillaries, into the interstitial, from the capillaries into the interstitial spaces. And edema actually happens when this hydrostatic pressure would increase in cases of congestive heart failure. So when this hydrostatic pressure would increase, there is so much pressure inside the blood vessel, thus it would release large amount of fluid into the interstitial spaces, thus it would lead to edema. Actually, this congestive heart failure would be subject to another topic, but this congestive heart failure is one of the factors that would increase the hydrostatic pressure, would increase the pressure inside the blood vessel, and would release large amount of fluid into the interstitial spaces, thus it would lead to edema. Another one is we also have the oncotic pressure. To further explain in here, so we have here the blood pressure or the hydrostatic pressure. And another one is we have the oncotic pressure. Oncotic pressure is the pressure exerted by large molecules or large proteins that are inside the blood vessel. These large proteins or large molecules are so-called albumin. And albumin has a very important function because it acts like a sponge, meaning it would hold onto water inside the blood vessel so that there would be no vast loss of water or fluid into the interstitial spaces. Otherwise, the patient or the animal would leak a lot of fluid and would result to death. So this albumin works as a sponge, or it holds onto water inside the blood vessel. And this oncotic pressure is the pressure exerted by these proteins. And what happens is that when this oncotic pressure would decrease in cases of hypoproteinemia, hypoproteinemia, anemia, which is a condition wherein there is an abnormally low levels of protein in the blood, is that since there are few or low levels of protein in the blood, the oncotic pressure is also decreased. Thus, there are a few cells or few proteins that would hold onto water, and it would result into leaking of fluid into the interstitial spaces. Another one wherein oncotic pressure is also decreased is in cases of structural damage or the damage to the structural integrity. So to zoom it up, we have here the capillary bed. And the capillary bed, as I have said, has pores or fenestrations. So when there is tissue damage in cases of what? First is tissue trauma. Tissue trauma or wound or injury. Another is in cases of severe inflammation, wherein when there is a severe inflammation, the capillary bed would become very leaky. Another one is we have in cases of burns, wherein the tissues already burned, thus at the same time, the blood vessel is already destroyed. So what happens here is that these pores or these fenestrations where the fluids constantly leak would widen. And as I have said a while ago, in the blood vessel, we have here the albumin or those proteins. Since these pores or fenestrations have enlarged, the proteins can be able to move out into the interstitial spaces. And again, I have said a while ago that these proteins exert an oncotic pressure that holds onto water. So what happens is that since this proteins moves into the interstitial spaces, the oncotic pressure would also be diverted into the interstitial spaces. Thus, in the interstitial spaces, these proteins would absorb or hold onto water, leading to edema because it would accumulate a large amount of fluid or water into the interstitial spaces since the oncotic pressure moved into the interstitial spaces. The vascular bed or the capillary bed becomes very leaky because the tissue or the blood vessel is destroyed. So that is one mechanism wherein we can be able to observe edema. Another one is when the lymphatic system is damaged. So, when the lymphatic system is damaged or obstructed in cases of trauma, in cases of tumor or neoplasia, and in cases of surgery wherein the lymphatic system is destroyed, it would lead to edema. So how does it lead to edema? Since I have said earlier that the lymphatic system is responsible in getting the fluid that is leaked into the interstitial spaces and return it into the circulation in order to maintain the balance of the circulation, is that when this lymphatic system or this network of vessels would become obstructed in cases of tumor or neoplasia, it can no longer absorb or it can no longer get those fluids from the interstitial spaces and cannot return back into the circulation. Also, in cases of surgery wherein the lymphatic system is already destroyed, it can no longer return those fluid that excreted into the interstitial spaces into the circulation. Thus, there is a constant leaking of fluid in here, and since the lymphatic system cannot be able to clear it up, it would lead to an accumulation of large volume of fluids in these interstitial spaces, leading to edema. So those are some mechanisms on how edema or swelling occur at the cellular at the circulation. So we have organs wherein we can observe edema. First is in the lungs. When there is an accumulation of fluid into the lungs, we call that the pleural effusion. Another one is in the abdominal cavity, wherein there is an accumulation of fluid into the abdominal cavity. We call that ascites. Another one is in the heart. This is just an drawing of the heart, wherein there is an accumulation of fluid into the pericardial sac that is called the pericardial effusion. And we also have the peripheral edema. Peripheral edema that can be observed in the extremities. We can classify them as pithing and non-pithing edema, wherein pithing edema is when you put your finger on the part where there is an edema, and then you can be able to see the indentation of your finger. You can be able to classify this as the pithing edema, and then the non-pithing edema. So these are the organs wherein we can be able to observe edema. So what are the therapy or the symptomatic therapies that we can be able to give in cases of patients who have an edema? So first is we have the antimicrobial therapy. Antimicrobial therapy in cases wherein we observe multisystemic signs. Multisystemic signs. Make signs in cases of rickettsial diseases or bacteremia. Antimicrobial therapy should be instituted with multisystemic signs, especially in disorders like rickettsial diseases and bacteremia. Another one is we can be able to use plasma transfusion in cases of patients who have hypoproteinemic disorders, such as when there is a low level of proteins in the blood, as I have said a while ago. Second is, third is we have the low salt diet and diuretics given to patients who have cardiac diseases like congestive heart failure. In diuretics, we should use diuretics with caution depending on the cause of edema, because intravascular volume is reduced when we give diuretics, and this would give an addition to a potent diuretic would contribute to the development of hypotension and shock. Thus, we should give caution when giving or administering diuretics to patients with edema. And then lastly, we have here orthostatic edema, wherein we can observe it in the extremities. As I have said a while ago, pithing and non-pithing edema. It's because gravity impairs the venous return, so the blood cannot go back into the circulation. It's because of gravity. Is that there are some things that we can be able to do. First is the elevation of the affected extremity. Another one would be giving support bandages. Also, we should increase the muscle activity. And then also, we should use cage paddings. And we should prevent the animal from lying on the extremity. It's because sometimes when they cannot feel the pain, they would definitely lie on the part wherein there is edema. Thus, we should prevent them or support them from lying from the affected extremity. So those are some of the symptomatic therapies that we can be able to give in patients who have edema. So, okay, that is the brief or simple explanation of edema. Thanks for watching.
Wave Beats Music.